is a registered nurse. She received her bachelor's degree in nursing from Cal State University at Fullerton and her master's degree in nursing education from Western Governors University. She currently works at Orange Coast Memorial Medical Center in Fountain Valley and has experience in medical surgery and telemetry as well. And she's an adjunct professor at Vanguard University. We are so glad that you are part of our family and providing such wonderful healthcare, Mariah. Also want to welcome Dr. Eric Ball. Dr. Ball and his whole family belong to our congregation as well. Dr. Ball is a prominent pediatrician in South County and all of Orange County, very active in the medical society. He did his training medical school at the University of North Carolina and his internship and residency at Stanford University and his fellowship as the pediatric chief resident at Stanford University. And so quite an impressive panel we have here to share with us. And so I'd like to begin by calling upon my friend, Dr. Ball. Welcome, Dr. Ball, and then we'll call upon Mariah to do her opening as well. Great to see you, Eric.
Hello, everybody. I'm going to try to share my screen. Play. Got that? Perfect. Happy birthday to the rabbi. By popular request, we're going to talk about COVID-19 vaccines today, and the rabbi is one day closer to getting into the age bracket where he can get his COVID-19 vaccine. So you don't look it, but I hope you're 65 today.
Thank you so much. Not quite, but getting there.
So I'm going to give a little brief presentation, then Mariah is going to speak, and then we will have some time for questions, hopefully. That's me. That's me after I got my second vaccine. So I'm almost a month out now from my second vaccine. So I'm fully vaccinated. So theoretically, I'm 95% protected against COVID-19. I got the Pfizer vaccine. So we're going to talk a little bit about the vaccine. And in case you're wondering, like, why do we need to vaccinate for this? Like, isn't this just the flu? Isn't this not such a huge deal, right? So here's this is about a week data. So in the US, we've had over 25 million cases now, and we're at like 425,000 deaths in just this year, right? So by comparison, the slide's a little busy, but this is flu deaths each year. And if you look at the very tippy top, that's deaths. So we average usually 20 to 50,000 flu deaths per year. So we have more people dying of COVID-19 each month than we have flu each year. And we've lost more people in 2020 of COVID-19 than we've lost from influenza for the entire decade. So this is a serious deal. Mortality rates for COVID-19 are orders of magnitude higher than they are for the flu. And part of this is because we have vaccines for the flu and we have some therapeutics for the flu and we don't really for COVID. But especially for the older population, the fatality for COVID-19 is really, really high. So let's talk super briefly about what COVID is. So COVID is a disease caused by the SARS-CoV-2 virus. Virus is just kind of an encapsulated ball of DNA or RNA. So this is an RNA virus. The RNA will code for more viruses. And think of the RNA as being essentially like the instruction manual for like an IKEA table. And the RNA will code for different parts of that table. And then in the cell, they will come together and form more SARS-CoV-2 viruses. So someone coughs or sneezes on you, the virus will enter your cell. It attaches to this thing called the ACE2 receptor through this little spiky thing on the outside of the virus called the spike protein. It enters your virus and it enters your cells and basically hijacks your cells. So your nose cells, instead of doing the things that nose cells are supposed to do, or your lung cells, instead of doing the things lung cells are supposed to do, they become factories for making more SARS-CoV-2 virus. And so the RNA from the virus gets into your cell, your body's, the structures in the cell then make all of these proteins. The virus has 29 proteins. So your cell will now make all 29 of those proteins. They will come back together and they will launch back out of the cell, killing the cell. So basically your cells are now working against you and making more SARS-CoV-2 virus. So let's talk a little bit about the vaccine. So this is how a vaccine normally gets developed. So it normally takes a decade or two to get new vaccines approved. And part of that is because it takes a long time for us to kind of figure stuff out, right? You have to figure out like, what is the, what disease are you going to fight? What's the genetic structure of it? What are the targets you're going to want to get the vaccine to fight against? And then you do safety studies. You do a phase 1 safety study, which is where you have a few people, you inject them, you just make sure it's safe. Phase 2, also for safety, some more people, and you're also seeing whether their body responds to the vaccine. Phase 3, you give this to a large population, thousands of people, half of them get the vaccine, half don't get the vaccine. You watch them over time and you see, did the people who got the vaccine get fewer diseases? So this process takes a long time. There's a lot of regulations involved. We've done this in less than a year, which is kind of crazy, right? This is like 4 times faster than the fastest vaccine we've ever had. We've done all of the same steps. So every step that's here, we have done. We've just done it in faster time frame, and we've done them all at the same time. So basically, we didn't do any research. So basically, every single researcher in the world has started working on SARS. So we had the genome for COVID within like a week of people getting sick with this. We knew it was going on. We didn't need to do all of this research ahead that usually takes 10 years. And then we started doing phase 1, 2, and 3 clinical trials at the same time. So we've had phase 3 trials going on for months. And while we were doing these trials, we were already building vaccines. So the day that the vaccines were approved, we had tens of millions of doses that had already been approved. They've been sitting in freezers and ready to go. And that's why this has taken such a short period of time. So all the safety structures are in place. It just happened in a condensed period of time. So I got the Pfizer vaccine. The 2 vaccines that are currently approved are Moderna and Pfizer. I'm going to talk super briefly about how these work. They're essentially the same. And so what they both are is a strand of mRNA that codes for the spike protein. So the spike protein is a little thing that attaches to the cell. Now remember how the virus has this RNA inside of it, which is basically like, instructions for coding for an IKEA piece of furniture. This structure, this will only code for one of those 29 proteins. This is essentially the instructions for producing the leg of a table, but not the whole table. They take this mRNA, which has the code, they surround it with this little ball of fat, of lipids, and they inject it into your arm. And when they inject it into your arm, this goes and it hits one of your cells, in your muscle cells, and the fat particle will fuse with the cell and it will release this little piece of RNA into your cell. Now your cell sees this RNA inside of it, and when cells see RNA inside of it, they turn RNA into proteins. So this turns your muscle cells into these little factories making spike proteins. They don't make the SARS-CoV virus, they don't make any of the other 28 proteins, they only make this one protein. Now when cells are making proteins, what they do is they put the proteins get kind of excreted out to the end of the cell over time. So these spike proteins then end up getting migrated towards the outside of the cell, and they sit there on the outside of the cell. So when they're outside of the cell, these cells that are inside of your immune system called antigen presenting cells will notice these cells. These are things that are just kind of hanging around in your blood, and they'll notice these little spike proteins, and they will know that these spike proteins are not normal. They are not part of Rabbi Steinberg. We've never seen this before, and we need to fight it off. This is something bad. And what the antigen presenting cells will do is they will present the antigen. They will basically on a pedestal hold up these little spikes, and T cells will come along and will recognize these spikes, and that activates an immune pathway. And those T cells then talk to these B cells, which make antibodies, and that's how your body will make antibodies against these spike proteins. This process takes about a week or 2 to go to fruition. And once you've done that, now your B cells are actively making antibodies against spike proteins, so that if the real virus comes into your body after you've been vaccinated, you recognize those spike proteins. Rabbi Steinberg's body says, I know that, that's not normal, that's not part of me, I'm gonna fight it off. And you have these antibodies which will attack the virus before it has a chance to attack you. So this prevents you from getting sick from COVID, even if someone sneezes or coughs on you. So the Pfizer vaccine, you'll get 2 doses, 21 days apart. The Moderna one, you get them 28 days apart. There was just a new Johnson & Johnson vaccine, which data came out yesterday. That's a single dose, so it's exciting coming down the pike, but not yet approved. Effectiveness of these vaccines is really high. So the Pfizer and Moderna ones are upwards of 95% protective. And we think the reason why these are so protective is the way these vaccines work is they're a much more natural way of getting immunity. This is your body. If you think about how that SARS-CoV-2 virus infected a cell, it gets inside of the cell, it makes these proteins and they get launched out of the cell. The mRNA vaccine does very similar things, but it only produces the spike protein and not the other proteins. Almost all the other vaccines we have are basically little pieces of cells. So it's a less of a natural way to get immunity. And we think that's why these work so well. So here's the data curve for the Moderna shot. So all these little dots, these are basically people getting sick over time. And as you can see, basically the people who got the real shot, after about 2 weeks after the first shot, when you would expect it to start working, they really weren't getting sick with COVID, whereas the people who got the placebo got sick in kind of a normal way. These have side effects, right? So I got mine. My first one was fine. My second one, I felt a little fatigued and achy for a day. It wasn't too bad, but about 50% of people will feel something, especially after your second dose. Not so much fever, but a lot of people just feel kind of achy or fatigued for a little bit. This lasts like a day or two. Compare that with the side effects of getting COVID, which is like you can die, but even if you don't die, you feel like crap for weeks. So, when you weigh the side effects of the virus versus the vaccine, the virus is way worse, obviously. So things that we still don't know with this is we don't know how long this immunity will last. We know you get a very robust immune response after getting your shots. We also don't know how long your immunity will last if you get sick with COVID. So that will remain to be seen. We don't really know what percentage of the population needs to be vaccinated before we can, go to synagogue again and have a gala in person. Big one is we don't know if the vaccine prevents the recipient from getting sick with the virus or actually carrying the virus, right? So I had both vaccines. I theoretically am 95% protected against getting sick, but we don't know whether I can still get my wife sick. And that's a question that needs to be answered. When they looked at these studies, the way they assessed this is they basically said, are you getting sick? Do you have any symptoms? And if you started having symptoms, they would test you for COVID. But they didn't test people routinely. So we don't know that if someone with COVID coughs on me, the virus might live in my nose. It won't make me sick because I've been vaccinated, but I might get other people sick. So even though I've had both vaccines, I am still wearing my masks every day. I am still socially distancing. I'm still being very careful. And then we don't know what long-term effects would be of getting the virus or getting the vaccine because these things have only been out for a year. So I think in the end, when you guys, eventually for those of you who have not been vaccinated, you will have the opportunity to vaccinate yourself and you have to decide, do you want to do it, right? There's a lot of unknowns for getting the vaccine or for getting sick. So I think you have to balance out the risks and benefits, right? I firmly believe that almost every human on earth will either get sick with COVID at some point or will get the vaccine. And you have to decide what do you want to take your risks for? And obviously, I think it's a no-brainer and it's much smarter to get the vaccine. So a few take-home messages. So one, this is a really bad disease. This is not the flu. This is not a common cold. This is killing, 500,000 people in a year in just the United States. And that's with us shutting down the entire country. We have now 2, and it looks like 4 or 5 very effective, safe vaccines. They've already been given to tens of millions of people. We have a lot of safety studies on those people, and it's very, very reassuring. The only way we're going to get out of this pandemic, the only way we're going to go back to synagogue, the only way my daughter is going to have a bat mitzvah in person is for us to have herd immunity where enough people are immune from the vaccine. Immune from the virus so we don't spread it around. And that's only going to happen either if most people get vaccinated or if most people get sick. And if most people get sick, millions of Americans will die. And that's not acceptable. And so every person has to choose, you're going to get the vaccine or you're going to take your chances and get COVID. And I think that's, an easy choice to make. So I'll close with, this is me a few days ago. So I'm fully vaccinated now. So I'm trying to give back. So now I am working at Disneyland and Soka, giving shots to the community. So I will be at Soka tomorrow. So if you happen to be on the schedule, I might see you there. Those of you who've been vaccinated, we need people to volunteer at these places. So please don't hesitate to do that. And that's my email if you guys have any questions. Thanks.
Thanks, Eric, very much. Really appreciate it. Just one observation. At a pediatrician's office, isn't it the nurse that gives the shots?
So, it's funny. So these people are, I give a few shots. So these
All
people
right,
are
I'm
telling me,
just,
so these people are telling me I'm doing a really good job. I'm giving really good shots. And a nurse comes over, one of my patients comes over, I give her a shot. It's a nurse. And the nurse looks at the needle and she's like, that's a really thin needle you guys are using. So she knew I'm not actually doing the good shots, they're just good needles.
That's funny. Mariah, please share with us your thoughts. What's it like to be on the front lines?
Yes, hi everyone. So I too, I'm about 2 weeks out from my vaccine as well. I did get Pfizer. So I do work at Orange Coast Memorial. Unfortunately, I'm on the COVID unit. So all my patients that I do see are COVID patients. And hearing Dr. Ball speak about the vaccine and the importance of the vaccine, and I know there's side effects and there's risks and everything involved, but I can't stress enough how important it is. And what I'm seeing family members, not being able to visit their loved ones, and I'm seeing patients die, and I'm seeing the severity of this illness. And I can't stress enough how important it is to get this vaccine and help fight so we can get back in person, have some normalcy. So I know there's the unknown and it's scary, but I hope everyone, is comfortable with getting the vaccine. I kind of just wanted to, with Dr. Ball, answer questions because I know this is so unknown. We don't know much about this. If you're not working front lines and seeing it every day, all you get is what's on the media. And so it's nice to be able to talk one-on-one to get perspective from, two people who are dealing with it on a daily basis.
Absolutely. So let me ask you a question first, Mariah, and then Dr. Ball. And the first question I have for you is, can you just give us an insight to the emotional impact of what it's like for people to be alone in the hospital when they're so sick?
Yeah, it's horrible. You have patients who have this disease and, unfortunately we don't have a cure. We can treat the symptoms. But unfortunately we're not allowing visitors into the hospital. So, and even with end of life care, we don't have families come in. We FaceTime family members to say goodbye. And that's not something you should ever do. Every person who, is passing away deserves a loved one to be there. And seeing that and not being able to do anything about it for, a job that I provide empathy and care for a patient is awful to see. It's something I take home every day with me.
Well, you're one of our local heroes, and we thank you so much for what you are doing. Really, I can't express it enough. We try at every Shabbat service to say so, but just know from our hearts to yours, we are so grateful.
Thank you.
Dr. Ball, talk to us about the balance between the mental health of our children and keeping them out of school versus do they get vaccinated? Do they don't get as ill as everybody else? I mean, walk us through the current thinking today, and I know it's probably different than it was yesterday, but the suicide rate, I understand, in one Nevada county is up 100% since last year due to the anxiety and depression people are feeling, especially our youngsters. Walk us through that.
Yeah, so this has been really difficult. I've basically become a child psychologist. We're dealing with so much mental health, and I wouldn't be exaggerating if I said I've had more mental health emergencies in this past year than I have in the past 15 years in practice combined. So it's a balancing act. The American Academy of Pediatrics strongly recommends that children be in person in school as much as can be done safely. There's been issues with that, largely with funding, because we're asking schools to do all of this and we're not providing them with funding for more, protective equipment for teachers or, things to keep the kids safe at school. But we find it's very helpful for kids to still be in school. We are all as pediatricians strongly advocating that teachers should be on the front line of getting vaccinated, and theoretically they're next up after we finish with this round of people over 65, and that will go a long way to getting teachers back at school. The Long Beach School District is already now vaccinating all of their teachers, so I think we're close to getting kids back to school. But it's all a balancing act, right? You can't. I don't think you could lock your kids in their house. They need to be able to go outside. They need to have. They need to get exercise. There's the Surgeon General of California actually has a really great site where she talks about mental health during COVID-19. And the things she talks about that are really important for kids to do are to continue to get exercise, to continue to sleep well. We're seeing tons of sleeping issues with kids who aren't getting out. They're going to bed at 2 a.m. and what have you. Eating well. A lot of people are just eating more poorly now because they're sitting at home all day and they're snacking. We are very much into mindfulness and meditation. So I recommend meditation apps to a lot of my patients. And then mental health services. I send a lot of kids to therapy. I think it's a really, really important aspect of taking care of kids at this time. But it's a balancing act. We don't want our kids to get sick, primarily because they will get their parents or their grandparents sick, but also we can't keep them locked up all day.
Thank you. Thank you. Mariah, talk to us about, I see you're commenting on the vitamins and whatnot. I mean, the medicine and the approach is changing so rapidly. How are nurses and techs and physicians keeping up on a daily basis? Do you have a morning roll call where they say, this is the new protocol and this is what we're doing and this is how we're approaching it?
It does, in fact, seem that way. So we do get our guidelines from CDC, and our directors and healthcare professional and upper management will brief us on what the new protocol is. And we are fortunate that we do have infectious disease doctors who are more closely talking with CDC to help provide us on the therapy and medication therapy for it. We do seem to be a little more standardized now with our type of care that we provide to the patients. I know in the very beginning, every day it was changing, but we do within the last couple of months, I feel like we're in the same protocol. We got our hands into what needs to be provided to the patient. We have an understanding of how to provide the care and what care. So hopefully we're on the right track, but we shall see, I guess, over time.
For sure, for sure. Eric, can you explain, and I've read this a ton of times, and it's a little fearful, that the arm hurts a little bit after the first dose, but after the second dose, your arm hurts a lot and whatnot. Why does your arm hurt from a vaccine?
Well, remember, you're turning your arm muscle cells into little spike protein factories, and your body is responding to that. So you're having basically an immune response locally in your arm and then throughout your whole body as well.
That's a good thing.
It is a good thing. So actually my first shot, I didn't feel anything. I felt completely fine. My arm was a tiny bit sore and I was like upset because I thought, oh, maybe I got a placebo. This is ridiculous. And then when I felt achy the second time, I was really happy because that was my immune system working. If your body, the reason why COVID is so bad is because no one on earth has ever seen this virus yet. Nobody has any immunity to it. So it hits everybody really hard. I mean, think about like when Europeans came to the New World and they brought smallpox with them and it decimated the Native American populations because they had never seen smallpox before. Same concept. When we give little babies flu vaccines, we actually give them 2 doses the first year because their bodies have never seen the flu virus. Whereas when I got my flu shot, I just need 1 because I've had 30 flu shots in my life. So you need to kind of boost up the immunity the first time.
And we should not take a preventative Advil or Tylenol before the vaccine, but take it after, maybe.
You definitely don't do it before. I mean, just philosophically, I don't like taking medicine if you don't have to. But there is some controversy. There are some studies that suggest it might blunt your immune response if you take anti-inflammatories after the shot. It's very controversial. There's actually studies going on about it right now. I mean, I kind of sucked it up and just took it, but if it's really bad, you should take Tylenol or Advil. I want to talk for 1 second about some, Stacy Blyweiss asked a question about variant strains coming out. So there are some, new strains that we're seeing in the population, which are scary because we're finding they're a little more contagious than other strains, and they might be somewhat resistant to the vaccines. What's super important about that is that they are killed by the vaccines. The immune response isn't as strong as it is for the current strains, but it should work. Most importantly, there is no mutation that a virus can make that can get through a mask. So if you wear a mask, it doesn't matter what strain you're in contact with, you will be fine. The other thing is that the mRNA vaccine, the way it's made, it's very easy to change the recipe. So you are just putting in the genetic code for that spike protein, and then you're putting it into a computer or something and it spits out, vaccine. All other vaccines, like the flu vaccine, you have to like take a flu virus, you have to replicate it, you have to kill it, you have to put it in eggs, you have to pull it out, you have to do all this kind of stuff. So for us to change these vaccines, the mRNA vaccines, you just change the software. You just change the code that you put into the vaccine. So you can change these really quickly. It's a difference between changing the software of a computer versus the hardware. Flu shot, you need to change the hardware. Every year we get different hardware. These are much more easy to change. This technology has been in development for over 10 years, and this is the first time they're actually using it. It's really exciting, and it will help us with variants if they become worse.